What if a virus you encountered during childhood could remain hidden inside your nervous system for decades and suddenly reappear as a painful disease later in life? Herpes zoster, commonly known as shingles, is a viral disease caused by the reactivation of Varicella zoster virus, the same virus responsible for chickenpox. After a person recovers from chickenpox, the virus is not completely eliminated from the body. Instead, it travels along sensory nerves and establishes lifelong latency within sensory nerve ganglia located near the spinal cord and brain. For many years, the virus may remain completely inactive. However, aging, immunosuppression, stress, cancer, certain medications, or other conditions that weaken immune surveillance can allow the virus to reactivate. When reactivation occurs, the virus travels back along sensory nerves toward the skin. This process produces the characteristic shingles rash, which usually appears as clusters of painful fluid-filled blisters on one side of the body. Unlike chickenpox, which causes a widespread rash, shingles is typically limited to a single dermatome. Patients often experience burning, tingling, itching, or severe pain before the rash becomes visible. The chest, abdomen, and face are among the most commonly affected regions. Because the virus directly involves sensory nerves, pain is often one of the most significant symptoms. In some individuals, the pain persists for months or even years after the skin lesions have healed. This complication is known as post-herpetic neuralgia and represents one of the most common long-term consequences of shingles. In certain cases, reactivation affects nerves supplying the eye. This condition, called herpes zoster ophthalmicus, can threaten vision and requires urgent medical attention. Although shingles itself is not spread through respiratory transmission, direct contact with blister fluid can transmit the virus. Antiviral medications can reduce disease severity and shorten symptoms when started early. Fortunately, effective vaccines are available to reduce the risk of shingles and its complications. Vaccination is particularly recommended for older adults as the risk increases with age. Shingles reveals one of the most remarkable strategies in virology. A virus acquired during childhood can remain hidden for decades before re-emerging as a serious disease. Today, it remains an important example of viral latency.